Okay, so Shawn, we're going to start.
Cool.
Okay. Welcome, Dr. Shawn Meirovici. Do I pronounce that correctly?
Oh, well, that's good. It's not
Okay.
Italian, but I like it.
Oh, it's not. What is it?
It's Romanian.
Oh, okay. Meirovici?
I like it. I like it.
So Shawn has been working as a naturopathic doctor in 2 clinics we were just talking about, in physiologic.
Well, actually 3.
3 clinics. Oh, well, that's new. So one is physiologic, which is your clinical space. The other one is where you are right now, Bridgeport Hospital, which is Physiologic Plus. You work, where's the third one? So we know.
Third one, on Fridays, I see kids. So I work at Kid Crew, which is in Midtown, and it's a purely pediatric clinic.
Oh, brilliant. That is new. We definitely have to update your IHN bio. So you've been working with neurological conditions such as traumatic brain injury, spinal cord injury, multiple sclerosis, and stroke. In 2011, Shawn, this is where you opened your secondary practice in the town of Erin. Is that where you're at? Okay. So Shawn was one of the first naturopathic doctors in Ontario to educate patients on using medical cannabis and acquiring an access to cannabis for medical purposes license through a variety of licensing clinics. Now, Shawn speaks to groups such as pharmacists, his own colleagues, of course, naturopathic doctors, nutritionists, various healthcare practitioners, including medical doctors, on the topic of cannabis. He is a medical advisor for the Cannabis Cooking Company, and he is, for the second year, no, actually, the first year you did guest speaking, the second, at that same year, you did a full evening lecture that was totally sold out. And now you're doing your first short con ed because you are relentless with your time. So we'll try and get you for a longer one in 2021. But you're going to be doing Understanding Cannabis in Clinical Practice for us in our con ed department. So thank you, Shawn, for your time this evening. And I'm going to throw it over to you. We really appreciate you being with us.
Well, thanks for having me. Thanks for setting this up, Julia and Melody. So I'm really excited to present this topic today because I love talking about cannabis. I find it really interesting and fascinating and an amazing emerging therapy for a whole host of chronic conditions. So today's presentation is going to be sort of a chunk that I've taken out of the full Con Ed course, and one of what I think is probably the most important chunk. And so it's going to deal with how do we go about thinking about dosing with cannabis, you know, for personal reasons, but also more specifically for patients who are using it medicinally. So that's going to be the main kind of chunk of today. Along that same line, I'm going to be talking about methods of administration and how different methods of administration metabolize differently in the body, and what are some things to take in consideration when you're dealing with someone who's taking it through inhalation versus someone who's ingesting it. So let's jump right into it. So just give me a sec here. I'm going to transition into my presentation. Screen. And okay. Can everyone see the screen now?
It looks good, Shawn.
Okay, great. All right, so this is how I'm gonna start, with a lovely picture of me. That's my daughter. That was taken a while back. She's now much older, and my dad. The reason for this picture is I wanted to start with a little short story about me giving my dad some cannabis. Okay. So about a year ago, my dad asked me to suggest something for his insomnia, because he saw that it was being useful for a lot of my patients, myself included, and he's been struggling with some insomnia himself. So I thought to myself that, okay, I'm going to start him. And he's a pretty big guy. He's over 6 feet. Not sure much how much he weighs now, but he's a big guy. He's probably like twice me. So I decided to start him cautiously anyway, which is always a good idea. On this pill right here, I'm not sure. Yeah, Spectrum still exists. So this is the Spectrum Blue Soft Gels. And over here, you can see next to the Blue Soft Gels title, the dose of the THC and the CBD in this mix. So this is a balanced oil that's been encapsulated. So 2.5 milligrams of THC and 3.7 milligrams of CBD. So for all intensive purposes, this would still be considered a low, even borderline microdose of cannabis. So, you know, I didn't have too much hesitation about this. So I said, okay, why don't you try this out and we'll see if it helps. Well, what happened was my dad had a total freak out. So this is more of a cautionary tale, and I've encountered this a few times, but we're going to talk about how cannabis is unlike any other medication, where you can kind of dose based on weight, height and weight of the patient. Cannabis is much more complex. You really don't know how the individual is going to react to the cannabinoids, and it doesn't matter how big they are, what age they are. Everyone is different. And so my dad turned out to be very sensitive to cannabis, and he probably has a genetic polymorphism that we'll talk about this a little bit later at some of the emerging research that I've included for you guys. But those with cannabinoid receptors that are more sensitive in the back of the brain, in the posterior aspect of the brain, have a higher chance of developing the unwanted side effects of cannabis, as opposed to those who have more sensitization in the frontal lobes of the brain, which is really kind of interesting. And that's some new research. So that's just a little cautionary tale to start off our lecture about dose and safety. So what we know and what we don't know. So as I said before, there's no validated dosage recommendations. This little blurb is almost taken verbatim from Health Canada, and it says something to the extent that unlike most medications, cannabis can't be prescribed at a certain quantity and frequency based on body weight and age. Everyone responds differently based on our unique physiology. So cannabis is a very different type of drug in that way. And that's why I feel a lot of medical doctors shy away from using cannabis medicinally, is because there's no really sort of set algorithm to how to dose someone. It's both a science and an art, but I'm going to give you some guidelines to follow with regard to how to properly dose cannabis so that the individual or patient has a good response from it. So we're going to start with some foundational stuff first, so a little bit more on the science end of things, and then we're going to jump into more clinical, the more clinical aspects of dosing cannabis. So patient's response to cannabis. So what are some of the factors that influence how a patient's going to respond to cannabis? So other medications that they're on, because almost all medications have an effect on liver metabolism, and that is going to also metabolize cannabis. So some medications slow down liver metabolism, inhibit. Some induce liver metabolism. They're inducers. So medications are important to consider. Conditions that they currently have are important to consider as well. Prior exposure. So this is really interesting. So when we talk about the therapeutic window, that meaning what is sort of the dose at which a patient has a good response to cannabis at the lower end of the window, and what's the dose that's going to put them into having some of the unwanted side effects. So for a new cannabis user, that window is quite narrow. However, we've been seeing that people who have used cannabis previously, that window becomes larger. And I'll talk a little bit more about that later. Genetics. So a few things with genetics. The endocannabinoid tone is important. So we're not going to get into that too much today, but we have something called the endocannabinoid system in our bodies, and that's why cannabis works, because we have receptors for cannabinoids. Everyone has what's called endocannabinoids, and these are the cannabinoids that our body makes itself. And depending on how that tone or how many endocannabinoids are active at any given time is going to affect how a person responds to cannabis. Brain chemistry, so mutations in certain receptors. So some more emerging research is starting to suggest that there's a whole bunch of different mutations of the cannabinoid receptors. So it's not like everyone has the same CB1 receptor. There's over like 17 mutations of that receptor. So we're kind of beginning to understand a little bit more how genetics plays into the picture when it comes to how a person's going to respond to cannabis. Metabolism, we'll talk a bit about that, how when you ingest cannabis, the metabolism is very different for when it's inhaled because it goes through first pass, meaning it goes through your liver, which changes the whole structure of the cannabinoids. Lifestyle, diet and exercise. So things in our diet can actually enhance cannabinoid effect, or they can diminish cannabinoid effect. For example, mango is supposed to enhance cannabinoid effect, and I've heard some doctors, cannabis doctors, recommending that their patients eat mango at the same time they ingest their oils, which is kind of interesting. Exercise as well boosts endocannabinoid production, thus modulating the endocannabinoid tone. And mental state, this one's often overlooked, but your mental state at the time when you take your cannabis has a large effect on the response to it. So I'm always recommending, especially for first-time users, naive users of cannabis, that they want to be in a really sort of safe space when they first take cannabis, and that will help to ensure that they have a good response to it. Some further factors, demographic factors, that plays into the genetics portion of everything. Their health status, so are they in good health or are they in poor health? That's going to play into how's their liver metabolism, how are their detox pathways, like their kidneys, their lung function. All that plays into how it's going to metabolize. History of cannabis use, we've talked about that. Method of administration we'll get into. The pharmacokinetics we're going to get into a little bit more. Isolate versus whole plant extract. This is a really interesting area of cannabis research, and I'm going to touch upon that at the end of today's lecture, but it's looking like that the, what do we call them, full spectrum cannabis extracts behave very differently to isolates, just THC or just CBD. Potency, of course, is going to influence dosing. So how potent is your product? Are we talking about something that's 10% THC or 30% THC? Ratios, so this is, the amount of THC relative to CBD, and tolerance. So, and that's the ECS means endocannabinoid system. So endocannabinoid system tone, which I just mentioned previously. Okay, so now we're getting into a little bit of the meat and potatoes of this presentation. So multiphasic dose response, what does that mean? So cannabis is unlike a lot of other medications which have something called a monophasic dose response, meaning that the more you give, the more sort of that specific effect you'll see. Whereas cannabis has more of this U-shaped curve, and it's not necessarily behaving in that way. So at some point, raising the dose will no longer raise the effectiveness, and it actually might decrease the effectiveness, and I think I show some studies on that, and will increase side effects. So the more, so if your patient's thinking that they will achieve a better response at a higher dose, it's not going to always be the case. In fact, they might actually get a worse response and more side effects. So here's a study here for you guys, a 2012 study of 263 opioid-treated cancer patients. So they were trying to control pain here. One group received 21 milligrams of combined THC and CBD each day. They experienced significant improvements in pain levels, and more so than the group that received 52 milligrams daily. The group that received 83 milligrams daily reduced their pain no better than placebo, but experienced more adverse effects. So actually the best dose here, or the optimal dose, was the 21 milligrams. And you can see that represented in that sort of bell-shaped curve image I have over here as well. So low, there's a point where the dose is too low that you don't see any benefit, and then you start to see a benefit, and then you hit that optimal dose, which we don't know what it is. It's going to be different for every single patient. That's where some of the art comes into play. And then increasing the dose, you start to lose some of the effects and start to experience more of the adverse effects. Receptor overload. So what happens, and why we're trying to figure out, okay, why does this multiphasic dosing response happen? Well, so we've seen some studies, and here's one from 1999, where when we increase the cannabinoid dose, we overstimulate the cannabinoid receptors, and they kind of get sucked back into the cell body, and they're either degraded or recycled. So that's where you get that tolerance happening when you're dosing really high with the cannabis. And this is something experienced by a lot of longtime cannabis users, that they need to keep increasing their dose to get any response. And we see this more in recreational users. But what's happening is we're overstimulating the cannabinoid receptors. Therapeutic window. So I talked a little bit about this. So we're trying to achieve that therapeutic window where patients are having a good response and they're experiencing the least amount of side effects or unwanted effects from their cannabinoid dose. Here's a study from 2010. It was 177 patients with cancer pain, received an oral spray of THC. Another group received combined THC and CBD at a 1-to-1 ratio. So this is really interesting. So the groups were allowed to gradually increase their dose until they experienced good relief. So kind of set them on to themselves and figuring out what dose works best from them. So the THC group ended up on average using about 27 milligrams daily of cannabis, and that's where they felt they had the best effect and the least amount of side effects, while the CBD plus THC group used close to 60 milligrams total milligrams daily, and they had superior reduction in pain. So one thing we do see quite often is that when you mix the two cannabinoids together, the two main ones, THC and CBD, you get less of a chance of adverse effects, but you sometimes have to increase the overall cannabinoid dosage beyond what someone just taking one isolate of a THC or a CBD might be taking. But in the long scheme of things, they might have to use a little bit more cannabinoids, but they're going to get superior effects without the side effects. So a little bit on some actual studies using CBD for anxiety. So this kind of optimal zone for dosing with cannabis is also in some of the studies, they call it the Goldilocks zone. This one was too hot, this one's too cold, this one's just right. So seems to treat anxiety at low to moderate doses, while epilepsy at high doses. So this is also something really interesting with some of these cannabinoids, in particular CBD, is that we're finding that Goldilocks zone for one type of condition, whereas it's different for treating a different type of condition. So with CBD, we find in terms of anxiety that the optimal dose is somewhere in the mid-range for CBD, But if you're going to be treating epilepsy, you're going to have to go higher for it to be effective, and you'll lose that anti-anxiety effect at the same time when you go higher with the CBD, but it works for epilepsy. So this was a 1990 study, doses of 2.5, 5, and 10 milligrams per kilogram increased the anxiolytic effect. At 20 milligrams per kilogram, it was no longer effective. So we saw this inverted U effect, which I've been talking about. So one of the theories behind specifically CBD for anxiety is that this low to moderate dose is thought to be the sweet spot that activates the 5-HT1A receptors, and those are your hydroxytryptophan receptor, which deals with serotonin, mood modulating hormone. And so that's one of the theories on why CBD is effective specifically for anxiety and depression. And here's the study at the bottom there. A little bit about microdosing. So microdosing is something that's becoming very popular with all types of, let's call them psychoactive drugs. And cannabis as well. And it's really interesting. There's a lot of science behind this now too. So ultra low doses can be extremely effective. So what's defined as a microdose? So it's taking a non or slightly psychoactive dose for the purpose of improving health and productivity. So what is a non or slightly psychoactive dose? You refer to different resources and they'll give you different dosages, but somewhere in between, if we're talking about THC, which it usually is when we're talking about microdosing cannabis, it's somewhere between 1 and 5 milligrams. Now think about my dad. I gave him 2.5 milligrams with CBD and he still freaked out. So you have to be really careful. That I've been finding the more years that I've been doing this, I've been a lot more cautious with the dose that I start patients off on who haven't or who are naive users. They're new users of cannabis. So I'll have them take like 1 milligram at first and work it up from there. Whereas before I'd probably start maybe like at 2.5 or around there. So another interesting thing for microdosing is that there's some studies to suggest that it's protective against a few things. So here's a few studies, one on heart attack and a couple on brain injury. And this seems to be protective towards those things. So, in the full cannabis course, I go into a lot more on the endocannabinoid system, but basically what our endocannabinoid system does is it prevents overstimulation. So it's like a sprinkler system that's putting out a fire in the body, maintaining homeostasis in the body. So when we have a serious acute attack, like either cardiovascular related or cerebral injury, the endocannabinoid system goes into full gear, trying to minimize the damage. A lot of the damage doesn't happen from the trauma itself. It happens from an overstimulated response of our immune system, creating a lot of inflammation in response to the trauma. And it's the endocannabinoid's job to kind of mediate that response so that it's not damaging itself. And so we're seeing with these microdoses that are kind of close to physiologic doses of our own endocannabinoids, we're getting some protection against a lot of interesting things. In my field, it's really interesting because one of these studies, as you can see on the bottom, from 2014, seems to be protective towards traumatic brain injury or the sequelae of a traumatic brain injury, the after effects. A little bit about the science of our receptors. So here's, we have a cannabinoid receptor 1. And just to give you an understanding of how this all kind of works and why it's so complex, is that on our cannabinoid receptors, we have 2 landing sites. So you can see one in red there over to, well, it's on my left. It might be on your left too. It's the red one. And then the orange or yellow, mango colored one, the allosteric receptor. So What happens with THC, for example, is that it is a partial agonist of that red receptor. And that red receptor, that's what, when you stimulate that, that's what stimulates the conduction or the response down the nerve. Whereas the allosteric receptor, what that does, if you bind to it, it actually changes the shape of the whole receptor. And that's more what CBD does. It kind of changes the whole shape of the receptor. And this is one of the theories or reasons that when you introduce CBD into the mix, it modulates the effect you get from THC. It lessens the chance of side effects and actually prolongs the effect of THC. So it definitely changes the shape of the receptor, and that change in shape lends these other sort of synergistic responses to the THC. So for a real life example, I had a patient recently, and they were taking CBD for anxiety. They were taking pretty good doses of it too, but she came to see me because it wasn't working. And so she wanted to know, what are the next steps? And so I told her to maybe start, I gave her a recommendation for a product that has just a tiny bit of THC in it as well, with the hope that it would start to synergize with the THC and she would start to see a response at lower doses with the CBD. So I've yet to hear back from her, so we'll see how that goes. But often that's what happens. So if someone's not having a good good response or response that you expect from one cannabinoid by itself, often introducing another cannabinoid, one or more, into the mix, they can achieve that response that they want at the same dose or a lesser dose. So let's talk a little bit about methods of administration, smoke versus vape versus, smoke and vape versus oils and edibles. So how do those make a difference in terms of how someone's going to respond to cannabis? All right, so I'm going to break down this image for you guys. I like this image a lot because it's easy to look at. So we're dealing here first with inhalation. So what happens when you inhale, and this is THC, but CBD works similarly. So when you inhale a THC product, through vaping or smoking, you get a direct amount of THC right into the bloodstream, okay? And then this circulates around the body. So it's a direct effect. And libertalis, we'll go to the next one, but basically down here, we'll talk about this more, but when you see, if you see the arrows at the bottom here, the middle, so it starts off with delta-9 THC, and that's what we all know as THC, and that's this psychoactive cannabinoid that we all know and love. When it goes through the liver, so this happens to a small extent when you inhale, but it's a much more significant effect when you ingest cannabis. Your liver actually changes it into a whole new compound called 11-OH-THC, which acts very differently from delta-9 THC, and we'll talk a little bit more about that in the next slide. And then eventually that gets coupled with some more oxygen compounds, and it gets ready to be discarded in waste. So now looking at ingesting, so you got a nice little picture of the stomach here. So we talked about inhalation. Now, ingesting, what's different here is that we don't get full circulation of the THC right off the bat. It has to go through the liver first, and that's called the first pass effect, okay? So stomach absorbs more than 90% of the ingested THC, passes it on, but the liver eliminates most THC before it ever gets into circulation. So when we're talking about someone who's ingesting cannabis, and is having like a really sort of psychoactive experience, it's really not delta-9 THC. It's the 11-OH-THC that's producing that effect. So bioavailability, there's a lot of fluctuation when it comes to bioavailability, and this is more on how dosing can differ from person to person. So we can see here on the left, in the lung section. So this is inhaled cannabinoids. So 10 to 35% get absorbed into the bloodstream. Now, look at this. User A and B take an equal dose, okay? So user A takes a dose, and then user B has up to 3 times higher THC concentration. And this is because this user B is a regular user. So again, going back to the fact that there is a marked difference between the patient who is a first-time user and a regular user. You know, a whole bunch of things with the regular user need to be taken into consideration. But one thing for sure with inhalation is they know how to inhale more efficiently. And that can raise their level of THC 3 times more than the naive user. Now, over on the stomach end of side, the ingestible cannabinoids, we see bioavailability 4 to 12% after first pass effect. Strongly diminishes bioavailability of THC, which we talked about, but increases the amount of this 11-OH THC compound. And there's a long time lag in peak concentration between users. So a lot of people who have taken cannabis orally, ingested it, have seen this, that the effect after ingesting cannabis, it can start to take effect from anywhere from 1 to 6 hours. And it really depends on a whole bunch of things, metabolism of the individual, the genetics, everything that I've talked about previously. So really want to start low with someone who's new to cannabis in general, but specifically ingesting any type of oil, because we don't know yet how long is it going to take for them to start to see an effect. So, you know, is it going to take 1 hour or is it going to take 6 hours? You know, I've had patients where, you know, I tell them to, if they're starting cannabis for the first time, give it 6 hours, like don't drive anywhere for 6 hours. And I've had patients come back and say, you know, I waited a couple hours and then didn't have any effects. So I went out to do some grocery shopping and then, whoa, it hit me. So that's one thing you really need to stress with the new cannabis users, that especially for those first, I would say 3 doses, they need to, first of all, do it in a safe place as for the psychological, mental aspect of it, but also to have a time period of about 6 hours that they can just kind of hang out, not need to drive anywhere, to see how long is that going to have an effect, or how long till it has an effect on their individual metabolism. And there's some other things to take into consideration with that whole timing thing. So I have noticed, and some of the literature is suggesting this, but this is more sort of an empirical thing that I've noticed, is that when patients are taking their oral cannabis with food, it seems to have an effect more like less time passing than those who are taking it on an empty stomach. And the reason for this is simple, and it's the same reason that I always tell patients to take any oil supplement with food, is that when we ingest oil, and a lot of you guys already know this already, our body secretes bile, which is basically like soap for oil. It helps emulsify the oil so that the body can absorb it more efficiently. So same thing goes with cannabis. So from now, for the past year and a half or so, I'm always recommending that patients take their cannabis oil with food. So here's some graphs to show how does the THC and the 11-OH THC hit our bloodstream in sort of a time-lapse manner. So after inhalation of 15.8 milligrams, which is about a joint of THC, and we're measuring from half an hour before inhalation until 7 days after. So you can see here what happens is the THC gets absorbed into the blood very quickly. So within about a minute, we start to see levels rise dramatically. And we see a peak level of delta-9 THC at about 10 minutes. And then it disappears almost as quickly. So by about an hour and a half, that delta-9 THC is almost at the original or like non-dosed levels. And then the 11-OH THC creeps up much slower. So you can see that at around 15 minutes, we're starting to see it pop up, and that's, the liver is going to be metabolizing some of that THC as it circulates around the body and making this 11-OH THC. And I'll talk about this soon, but the 11-OH THC might actually be more of the reason people have a significant high from cannabis. So even that small level that we see creep up at about 15 minutes, that actually may be more significant than the THC itself. Then if we go on to ingestion, average concentration delta-9 THC and its metabolites after ingestion. So here is 20 milligrams of THC, so I guess 1 chocolate cookie of THC, measured from 45 minutes until 24 hours after consumption. So look at this. The delta-9 THC is almost negligible, and it's actually a bit lower at around 2-hour mark, 2.5-hour mark than the 11-OH THC, and that's when we start to see people start to have their effect, right? Anywhere from, let's say, with a 1-hour mark to about the 2-hour mark, and then it still increases for about 6 hours. So that really explains a lot of those, a lot of the high effects that people who are ingesting oils will have over the span of about 6 hours, because that 11-OH is slowly creeping up in their bloodstream as their liver metabolizes it. So to explain that a little bit further, I like this quote at the top. The higher, sorry, I just got a pop up here. I got to remove that from, there we go, the screen. The higher the THC levels, the higher the user, not necessarily true. Well, at least not the delta-9 THC levels. So time delay, the psychological peak happens a good while after peak in blood levels, as we saw. So when patients or users actually experience that high, it's a good while after we see that peak in delta-9 THC. So the correlation study suggests more that the 11-OH THC is the primary driver of the psychological high, despite its smaller quantity. So, we're talking all the time about THC, which is delta-9 THC, but when we're talking about the psychological effects, it might actually be more correlated to the 11-OH THC that our liver makes once we ingest it. So 11-OH THC, and there's a few reasons for that. So what does 11-OH THC do differently than delta-9? So it passes the brain barrier more easily, so it gets into the brain a lot more easily than delta-9 THC does, and it's 3 to 7 times more potent than delta-9 THC in activating the receptors in the brain. So even though, let me see if I can actually go back a slide. There we go. So even though we see dramatically higher levels of the delta-9 THC, we have to take into account that that orange line is somewhere between 3 and 7 times more potent than the red line. So that's why there's that discrepancy in terms of our blood concentrations and the actual psychological effects. So go back here. So let's talk about some of the clinical aspects of dosing. So how I break it down when we're talking about dosing with a patient is there's 3 things you need to do with that patient. You have to assess them, you have to advise them, and you have to counsel and educate them. And that's our way of finding the safe and effective dose for them. So assess if the patient is taking appropriate cannabinoids, so THC, CBD, and now, we're seeing a lot more cannabinoids coming into the picture. I mean, we've known about them for a while, but breeders are actually breeding new strains to be higher in some of the other cannabinoids that we don't hear of too often. One of note that you can actually find some strains on the Ontario Cannabis Store that have been purposely bred to be higher in CBN, cannabinol, which is another psychoactive cannabinoid that has a very potent, let's say, sleepy effect. So it makes you very, very sleepy. So it might be useful in terms of treating insomnia. Advise. So advise on the appropriate dosing, titration, and the use of a symptom log. So you can buy, so I like these symptom logs. You can buy them on Amazon. I'll show a picture in just a sec of one. But the patient could kind of write down when they took their dose, how much was the dose, and then, you know, when did they start to see effects, how were the effects, so they could keep track of how that both their dose and how they felt on that dose. Counsel and educate. So we're mainly counseling them on some of the side effects that they may experience. And the more education, the better, because the patient will be less afraid to take something. And if they do experience some side effects, they'll know what to expect. And so they will be nervous or afraid about those effects. So finding the right dose, using the correct dose of cannabis it's the most important factor of having a successful therapeutic relationship with cannabis. So that first dose is really, really important for not only will the patient try it again, but have a good effect and therefore be able to use it appropriately and effectively for whatever they're treating. We all have unique internal chemistry, and the cannabinoid system is very complex. So we've talked about this, you know, there's so much complexity in our biology, and we're dealing with something that is more of like a living thing, a herb, a plant, than a pharmaceutical drug. So it's going to have a lot of complex relationships with how it interacts with our body. With cannabis, it's important to remember that most people, less is more. So I can't stress this enough, that a lot of people will have best effect at a lower dose than you might think of. So a higher dose may increase side effects without increasing therapeutic value. So that's going back to our talk on the therapeutic window. Sensitization effect, we talked about this too. Actually, we didn't really talk about this, but it's a really interesting phenomenon that you have to be aware of. So patients new to cannabis may only feel response after a few tries at the same dose. The body is upregulating cannabinoid receptors. So for some patients, and we've all heard, or well, maybe not we all, but I've definitely heard the story of people who, you know, try cannabis, like they're out with friends or whatever, and they have like a couple puffs of a joint and they don't feel anything. Yet the next time they have it, it like, you know, knocks them on their feet. So that's important to note with the new cannabis users, that you want to start at each dose and try it a few times before raising the dose, because the body may be upregulating its cannabinoid receptors, and you don't want to overshoot that therapeutic window prematurely. So you want to give the body a chance to upregulate those receptors at a single dose before increasing the dose. So here's a little case for you guys. So RF, 77-year-old female with type 2 diabetes and diabetic neuropathic pain. Very common reason that someone would see me at the clinic. So seeking my advice or your advice on taking cannabis to help her with her pain. So here I'm going to show you how to implement the assess, advise, and counsel template. So assess. She's a first-time user of cannabis, retired, no history of psychosis. So that's an important one when we're talking about safety. So one of, you know, it's a contraindication, but it's also a relative contraindication now that we're starting to see more and more studies using CBD in particular for treating some of these psychoses and mental health conditions. But certainly for THC, it can trigger a psychotic episode. It's rare, but it has been known to happen. So that's one thing that most cannabis licensing clinics will include on their intake, is asking if there's any history of psychosis. So important to ask that question. A high CBD/low THC edible oil minimizes her exposure to THC and is easily titrated. So we're gonna start her off in 1 milligram per mil THC and 20 milligrams per mil CBD for 3 months. So a product that contains those dosages. advise. So we're going to advise her to begin with a low starting dose of 0.1 mil. So that's going to, if we do the math here, it's going to be 2 milligrams of CBD twice per day with food. And it's going to be a negligible amount of THC, right? 0.01. Or it was at 0.1. So gonna twice per day with food, as I mentioned before, because it's an oil. And we're going to keep a log of the dose, the method, and the feeling. And we're going to titrate slowly over the next 2 weeks. And counsel. Review the titration process, provide with a recording log, and counsel the patient on potential adverse effects. So we're going to talk about the potential adverse effects with taking THC. Take with food to increase absorption, as I mentioned. Refrain from driving for 6 hours, also mentioned that. Keep cannabis in a lockbox out of reach of children and pets. That's always good to mention too, especially with patients that have families, and we'll follow up in 2 weeks. Now, this next slide is good. I give this to a lot of my patients so they have something tangible they can refer back to in terms of how to increase dosages of particularly cannabis oil. So the most important thing here, as you can see, is that you're going to be taking the same dose for 3 days at a time before increasing it. And that's for that sensitization effect that I alluded to before. This was put together by the Canadian Pharmacists Association. So they're going to take one dose of 0.1 mil in the early evening. They're going to keep a log on how they felt, how long did the effects last. We're going to record how it affected her pain, her neuropathic pain. So that's days 1 to 3. So if she experiences good relief with that first dose, done, that's the dose. But if nothing, if she doesn't feel anything or doesn't achieve a dose that's working for her, starting on day 4, we're going to increase the dose to 0.2 mils, and we're going to stay there for another 3 days. Now, days 7 to 10 and beyond, going to increase the dose again to 0.3 mil, 6 milligrams of CBD in the early evening every 3 days. And we're going to increase this dose by 0.1 mils every 3 days, okay? Once an effective single dose is determined, we're going to repeat that dose 2 or 3 times per day as needed. Okay, so that's really a great way to discover what's the optimal dose for that patient. And I can't stress enough, going back to that story that I alluded to at the beginning, to start at a low dose. So this is one of the patient journals that you can buy on Amazon from Gold Leaf. And it's really cool. You should definitely check it out. It's got, it's pre-filled out. So like, it says, I took my cannabis at this time. I felt this way. This is how long it lasted for. So that's all pre-filled out. So the patient just has to fill it in. All right, some emerging research for you guys. So I added this quite recently. Why do some people chill out and others freak out? So we've all heard these stories where, someone takes cannabis and has really good calming effect for them, and just a really good sensation in general, and another person takes it and they completely freak out. Think of my dad. So this is a report from 2019 at Western, so local. And so they were studying the divergent psychological effects of THC. So there are people who are interested in this phenomenon. It was a rat study, so they're moving on to human studies. Rat study found evidence that reactions depend on which part of the brain is most sensitive to THC. So the anterior, if the anterior part of your brain is more sensitive than the posterior, you're likely going to have rewarding effects. And this has to do with some of the opioid receptors and things like that. So you feel at ease, reduced anxiety, and joy. However, if you're more sensitive in the posterior area of the brain, you're more likely to experience negative effects, paranoia and fear. So this is really interesting research and might explain a lot of why this phenomenon happens. So I'm closely following it, and yeah, basically I'll try and keep you guys updated somehow to that research if it comes out soon. So there's a lot of labs that popped up, and this one's actually a Toronto-based one. And so they're actually testing for genetic mutations when it comes to cannabis. So they're really trying to figure out, who's going to respond better and who worse, and what type of dosing might you have to do with your cannabis through your genetics. So as I mentioned earlier, there's 15 variations of the CB1 receptor gene, 11 mutations in the FAAH gene, which breaks down cannabinoids, and 7 mutations of the cannabinoid receptor 2 gene. Since there's a lot of variation in the population, even when it just comes to your cannabinoid receptors. There's also liver metabolism, and liver metabolism relies very heavily on genetics as well. So according to your genetic polymorphism, you are either a good liver metabolizer, or you're an adequate liver metabolizer, or not so good liver metabolizer. So these guys have developed sort of a 23andMe type augmented test to look into some of that. And so I've included their website here, Lobo Genetics. This is the test kit, what it looks like. It's just all the DNA tests are usually oral swab kits, so they're testing saliva samples. All right, this is going to be the last little bit. I'll run through this kind of quickly because I want to leave some time for some questions. But when I talked about that, the difference between a full spectrum cannabinoid preparation to just an isolate. So what we're seeing is that we get a very different response. So we've talked a lot about this inverted U-shape response. We can see that here. This study was looking at a group of people who have a, what's it called, a phobia of public speaking. And they were given CBD. And you can see here, there's a placebo, there's clonazepam, and then CBD. And here's our sort of U response. So at the first dosage here, 100, I believe, I'm not sure if that's milligrams. It's in my course, probably in my slide notes, but I can't really see them right now. But let's just say 100 milligrams of CBD, there's not much of an effect, but at 300, they're having a really good effect. But then if we go higher, 900, you lose the effect again. So there's that optimal dose. So how do we overcome this bell-shaped dose response of cannabidiol? It's likely other components in the extract synergize with CBD to achieve the desired anti-inflammatory action that may contribute to overcoming the bell-shaped dose response. So check this out. It's not the most sexy slide, but it's pretty cool. So they have rats here, and they're in the first section here, they're measuring paw thickness. So that's really just inflammation. And so what they have is just the CBD isolate in the first graph, and then the clone 202 extract is CBD mixed with other cannabinoids. And so what you start to see, like if you kind of just look at it in general, see how it makes sort of a U-shaped curve in the first graph. So we're seeing like best response at 25 milligrams per kilogram of CBD, and then we start to lose our response. Whereas in the clone extract, we start to see more of a linear response. So, 50 is better than 25. Then we see a little kind of spike at 100. And then again, it starts to come down at 150 milligrams per kilogram. And then down at the bottom, paw withdrawal threshold. So that's how fast basically does the rat remove its paw from like a pain stimulus. So in the first window here, we kind of see, looks like 50 milligrams per kilogram is good. And then we're starting to lose a bit of effect at 100 milligrams. Whereas in the clone 202 extract, now it's starting to look like much more linear response. So the more we give, the more effect we have. So we're changing that biphasic response to more of a monophasic response, more behaving like other drugs when we include a full spectrum cannabinoid extract. And again, looking at tumor necrosis factor alpha, which is an inflammatory compound, again, here in the first one, we see that kind of U, inverted U, or that's not really inverted, it's a U shape here, 5 milligrams being the best. And then again, it's very obvious now. You can see how the tumor necrosis factor alpha really starts to diminish the more and more you give. and same for the bottom. So in summary, we're trying to achieve the minimum psychoactive dose. THC makes you feel something. So we're talking about THC. So that's what I usually tell patients is that you'll notice when you're starting to achieve that optimal dose is when you start to feel something. And that something is usually a calm and relaxed feeling. Yeah, I knew I had some sort of image here. So we're always trying to achieve a balance between symptom relief and impairment. We're also have to take into consideration, especially if we're dealing something with THC, whether they're going to be dosing in the morning, afternoon, or night, because they might be working, and so they need to be able to work at a good capacity. So they don't want to be too high. Administration method and form. We talked about that, ingestion versus inhaled. The ratio, so the cannabinoid ratio, how much THC in relation to CBD, severity of symptoms, titration. So in summary, it's a lot of trial and error, and it's both an art and a science. Shameless little plug here. So I do have a YouTube channel where I review a number of products from the Ontario Cannabis Store. So you can check that out on YouTube. I try and do a new one every week or two. So it's pretty current. And that way you can see specific products that are available through the Ontario Cannabis Store and what I think of them. Finally, I just included this like last minute, but I anticipated someone's going to ask, smoking versus vaporizing. So we still don't know what the long-term effects of vaporizing are, but it's likely safer than smoking. We're just not combusting the plant material, so there's a less of carcinogenic compounds being put into our lungs. I thought this was really interesting. If there's one thing to get out of this slide, it's this vaporized gas, which is really kind of cool. It says here that, is that the part that's, oh no, down here. So 95% of the THC in cannabis is absorbed in the first few seconds of inhaling. So, there's this old adage that you need to kind of like hold your breath to increase the effect. But it's kind of like coffee in the sense that, when you brew coffee, most of the caffeine is extracted with like the first, few seconds of brewing it. Same with THC. So most of that THC gets absorbed in the first few seconds of inhaling. So the tip is to take small, shallow puffs. Okay. Safety. That's part of the full course that's coming up in April. Okay, I'm going to switch to the other mode here, so you can see my face. Stop broadcast. All right, I think I'm back. Am I back, guys?
Fantastic. You're very generous with your information. You share with us so beautifully, as an educator should, and it's just so fascinating, everything you've shared with us. So thank you from all of us on the call. Now we do have a few questions.
Sure.
Oh, you know what though? Did you share that you're doing
yeah.
a little bit about the content of the
the full course? Yeah,
Yeah.
so let me do that now. In April, we're doing a 2-day course, 14 hours of information. Now, it's not all going to be lecture. There's going to be some group work, some activities, make it very interesting, but it's really a deep dive into cannabis in a clinical setting. So everything from looking into the history of cannabis, to the endocannabinoid system, to cases that I see in the clinic. Of course, we'll talk a little bit more about dose, but as you saw, the next section is safety. So talking about cannabis safety. We're hopefully going to do some cooking demonstrations with cannabis. So yeah, it's going to be a wild time.
Good. Very good.
Okay.
So Mal, we can close out and have a good evening, and we'll be talking to you real soon. Thank you.
Okay, great. Thanks.
Okay, good night.
Good night.